Hello, welcome to week 7. You have completed all of your systems assessments last week, so you should be able to finish up your assessment and work on completing your final project between this week and next week. This week we'll talk about special adult populations. You may have already encountered this based on who you just chose to complete your assessment for. The hospitalized adult definitely has a different reassessment. Whether the health history is probably done already. If it's a complete health history, you may need to review portions of it. You also may have a systems assessment for the hospitalized adult. You may want to look more in depth based on your patient if things are going on that you're not sure about. Perhaps you need to do a more complete health assessment for this patient. Look at their electronic health record, look at their activity, and think about all of the systems and how they interact. The pregnant woman is always a separate category. Things are different. You have a lot more history to look at with their menstrual history, gynecologic history, obstetrical history, their current pregnancy, and then any other medical history and family history in the background. They have a nutritional history that needs to be examined, and any environment or hazards that could harm the pregnant woman or the fetus. There are also cultural considerations with pregnant women that are very differing on whether there's pica involved, things like that, that based on their culture they feel those are normal for the pregnant woman. You also have objective data that's going to be different, and the pregnant woman during a full assessment will present differently perhaps than, depending on the stage of her pregnancy, than the normal adult woman. Because things are displaced in the abdomen. So your abdominal assessment may be completely different. You'll also add the exam of the fetus, Leopold's maneuvers, how the pregnancy is progressing, and if they need a pelvic exam, if there's an ultrasound that needs to be completed, and how large the uterus is based on the patient's dates. So there's a number of things to consider with a pregnant woman. The older adult, you have things to consider, and a lot of it is based on function. How are they functioning at home? How are they functioning in the environment that they're in currently? Are they able to care for themselves? Is there a risk for abuse or neglect? Is there mistreatment? So that caregiver assessment, so it's not just the patient, you may be assessing their caregiver as well. Spiritual assessment, special considerations, if they've got a chronic illness or a terminal illness, things to think about of natural age decline. And is it natural age decline, or is there another problem that we need to look at and assist this patient with? Those are all definitely special considerations for the older adult. So based on your assessment, you may have incorporated some of these things because of the patient you've assessed this 8 weeks. Go ahead and finish up your final project and submit that at any time after this.